So, once again, thank you for attending this very important meeting. Today we will be discussing the 65 Plus Strategic Communications Initiative for our older adults, 65 plus, and promoting the vaccine uptake for this population. And again, the three words we will keep closest to us today: vulnerability, exposure, and hospitalization. These are three very critical terms. In terms of an overview, today we'll discuss, as I mentioned, the Club 65 plus vaccine intake, understanding the 65 plus demographic. We will discuss some goals and objectives of the communications proposal before us, and tailored messaging strategies, multi-channel communication approaches, and certainly measurement and feedback as it applies to continuous improvements. As I mentioned earlier, one of our goals is to have a better understanding of the 65 plus demographic, and so we will discuss this, turn our attention to these special needs for this population. Health communication is not just about facts. It's about how messages are designed and delivered and received. And that's a big part of learning to understand this population. Key health challenges and vaccine needs of 65 plus. These include increased vulnerability due to their chronic health issues and weakened immune systems. Chronic health conditions impact certainly their susceptibility to infectious diseases and complications in older adults. And of course, vaccine uptake is important because it's preventative and it prevent these illnesses such as influenza, pneumococcal, and COVID, or excuse me, RSV illnesses that create complications and cause hospitalization. And so all of these causes misinformation, concerns about side effects, access challenges, medical institutions, and the lack of current funding due to the extinguishment of the bridge program, and now these Medicare, Medicaid cuts that are coming about. All of these will have impact on this population. This population of growing seniors 65 and above in these three communities, they have had a very bad time because 9 to 14% of these seniors live under the poverty level. And can you imagine what that's done in terms of them not being able to get their vaccines, not since we've had the closure of the CDC's bridge program, and now we have these cuts that are coming down in Medicare, Medicaid, and so we're going to see more under and uninsured older adults in this population, and so we need to be able to afford them targeted support so that they are able to get these vaccines. I think of communication as a bridge to vaccine equity, and there are some strategies and tactics, and we are about to embark on this partnership, which is absolutely considered a strategy to engaging with this community. And they also, as provider and patient, that's the next level. where they will have partnerships to help them to obtain these vaccines. With respect to strategic analysis, absolutely we have to look at our strengths, our weaknesses, our opportunities, and our threats. Our partnerships and messaging, those are big strengths. What weaknesses fall where we have trust gaps with our our older adults and our inability to do tailored outreach with them, but there's an opportunity to do that. And of course, the threat is misinformation, which is always a threat to any population. Key theoretical models, we want our partnership, our programs to be uh, engaged in grounded strategy, and that means evidence-based. And so we have theories, these theories that we're going to be looking at to incorporate into our initiative are going to be theories that help ground us and guide our tactics as. And so communication is, as I've mentioned, the bridge to vaccine equity. Free vaccines, no membership needed. This is the term that we'll hear a lot of because this is what we will be acknowledging to this population. There's a term called polyphonic, and it's relevant in that it identifies how we communicate with one another. So each of us may get the same message as is evident here, no membership needed, but someone else may hear it as, but I don't need a membership. So again, communication is very important. We all have to be in line and in tune with what's being said and how we receive it. And messaging is very important when we're speaking with adults in this population. Again, strategic integration of polyphony just means that we have here are the different stakeholders and they're receiving the message, same message, but they're interpreting it as it meets their own needs. Here, engagement with stakeholders is very important. We want to make sure that we engage effectively, and that includes all of us, including the seniors that we're taking care of as part of the partnership. We want to be empathetic. We want to make sure that we are that we're able to guide them in the right direction. We want to make sure that our policies and procedures are easy for them to follow and understand. And we certainly want to continue to build a trusting community, trusting relationships in this population. Engaging, again, stakeholders, we have to make sure that our communication is effective. And so here we are, this is the feedback loop, and these are our stakeholders. We want to make sure that our goals are on target, that we're promoting, that we're aware, that we're ensuring, that we're empowering, that we're giving and communicating as we are on target to do. Our messaging has to be correct, it has to be age appropriate, and the content and the language has to be appropriate. Make sure that we are evaluating and that we do have a matrix for evaluation. Evaluation. Outreach, always very important. Coming today, I'd like you to, for your takeaway, to just give some thought to, by presenting the evidence and framing the inequities today, that the need has been communicating, and how we transform it, we will discuss in our next meeting. Thank you.